Jakarta's hospitals and Java's hospitals in general are under unprecedented pressure, and this is where you can see the result of that. This is one of the new COVID-19 burial sites in Bekasi on the outskirts of Jakarta, and as hospitals are under increasing pressure during this second wave of infections here in Indonesia, many patients, many sick people have been turned away from hospitals and forced to isolate at home, no matter how sick they are. And as hospitals are forced to turn away patients because they are already at 90% or 100% capacity, people have to stay home, and it's up to their families to do whatever they can to keep them alive. And in many instances, they're unsuccessful at doing that. Some are trying to buy oxygen tanks or medication to keep their loved ones alive, but the death toll is increasing because of this crisis. These gravediggers have been working non-stop. We've been observing the situation here for the past few hours, and the bodies never stop coming. These men never stop working. Such is the situation, the scale of the crisis here in Indonesia. The Indonesian government says it is working to try to rectify the crisis in some ways, including trying to source more oxygen for those in critical need. That includes trying to source oxygen from neighbouring Singapore. The health ministry also says it is attempting to add more beds to hospitals, as well as increase the number of isolation facilities. But healthcare workers say that they are overwhelmed and overrun, and that no matter how many beds there are in these hospitals, the simple reality is that there is not enough healthcare staff to cater for the demand. Right now, there are far too many people falling critically ill in Indonesia for doctors to take care of all of them, and this is the result.